Hey guys, I just wanted to kind of give you a little more detailed description of your upcoming assignment, the healthcare policy paper. Your first draft will be due and you will submit that on the Blackboard discussion board. And then you'll have a week to review whoever you have been assigned to for your peer review. So make sure that whenever you submit your first draft, it's going to be worth 10 points. And I'm looking that you're submitting first on time, and then secondly, that there is enough content of the paper that your peer review can really give you a good critique of your paper. As you're grading your peer review's first draft, that's going to be worth 20 points. I'm looking for the quality of comments that you give, that you're looking at grammar, you're looking at APA, and also looking at the content. So what I would do is I would take the rubric of the health policy paper and compare that to your peer's paper that you're reviewing. Make sure that they address every component that is composed in that rubric. And then make changes and submit that back to them as a reply to their post on the discussion board. So just kind of going through the healthcare policy paper specifically. So I kind of like putting the BSN Essential, the course outcome, the program outcome that we are addressing with our assignments, because I don't want you to think we're just giving you assignments for busy work or just for have you something to do. Every assignment, we tie it back into our outcomes that we're trying to meet for this course and for the program overall. So that's what this first part is for, and this kind of gives you the purpose of the paper. So the directions is you're going to look at the legislative bill that you had selected in discussion board 2. So everyone should have done that by now. And then you're going to look at the rubric and just kind of expand upon that legislative bill or policy that you have selected. So your healthcare policy paper rubric. So the first portion here is just basically the portions that we have are our grammar and APA that we normally have. So 15 points will be devoted looking at your grammar and APA. Just let you know that you will have a title page and you should have a reference page. Your references should be peer-reviewed and within the last 5 years. So the article should be from 2011 and earlier. Also, too, we're just going to have first and second level headings on the paper. So we don't need third level headings. So make sure you look in your APA book how to correctly make a first level and a second level heading. So your first part of your paper will be your introduction. Again, as you've learned in your APA writing workshops and in your AP manual, we do not use the first level heading of introduction. Introduction is assumed that's your very first paragraph that you always write with your papers. So the reader should know that that is your introduction. So it does not need to have that heading. So you will identify introduction. I want you to identify the problem and provide a summary of what the paper will include. So kind of let me know what I'm expected to read in this paper. What's the problem? What legislation am I going to be reading about and learning about? Then in your second paragraph, actually starting the content of your paper, you're going to state the problem. State the problem should be your first level heading. It doesn't have to be exactly state the problem. It could be staffing, decreased staffing, or inadequate staffing. That could be your first level headings. So whatever your problem is should be your first level heading. And then in the content, you're going to identify what is the problem. Include a literature review of at least 2 scholarly articles. So again, those should be in the last 5 years. And those scholarly articles should help identify and support the issue that you are describing. So again, if someone's doing staffing, find me where there's 2 articles in the last 5 years that support that staffing is an issue overall in healthcare or in nursing. Or if you're doing veterans access to care, what is the issue with access of care that veterans are receiving now? And give me 2 articles that support that this is an issue. Realize that every time legislation is brought to Congress or wherever entity it is, you have to bring a reason why this is a problem. We just don't pass laws because there's no issue. There's always an issue that causes an action. So this is why I want you to really look at what is the issue, what are we trying to resolve with this piece of legislation. So it'll be 2 to 3 paragraphs. The next one is selected bill. So your next first level heading should be whatever bill that you are presenting. It should be like the bill number, exactly the title of the bill. So then I want you to present and analyze the selected bill. What is the bill? What is it proposing? What is it, the state or federal level? I think most of you have selected ones that are at the federal level. What legislator representative is proposing the bill? So who has introduced this bill and created this bill? And then where is it currently in the process? Has it went to the committee chairman, or so just where in the process has it begun? And that should take about 1 to 2 paragraphs. The next should be your stance on the bill. So, and at least one article to support your response, again, the last 5 years. So if you're for the bill or against this bill, but why? What's your evidence-based research, your evidence-based practice that tells you this is why I believe this bill should be passed, or this is why I believe this bill should be voted no. So provide me with evidence for your stance. The next component is supporters versus opponents. This should have 2 sections. It should have 2 levels. So your first level heading should be your supporters and opponents, and then you should have a second level heading identifying potential supporters and opponents. So who would support this bill and who would maybe be opposed to this bill. And then the next second level heading is who is going to be helped by this bill and who could this hurt. I'm going back to staffing, because a lot of you have picked that piece of legislation as well. So potential supporters definitely could be maybe nurses, direct patient care nurses. Maybe we feel that we're taking care of too many patients, that this is decreasing nursing retention, so forth. But opponents to this bill may be CEOs of companies, because that's going to change the financial impact of their business. It could be also patients. Think about maybe the increase in prices that they're going to have to pay to support that increase of nursing hours involved. So thinking about those 2 components, maybe your winners and losers. Maybe people that are going to be helped by this, again, is kind of similar. Maybe nurses, direct patient care nurses, may be helped by this. Think about people that might be hurt. Again, maybe the increase in price of patients, especially patients that pay out of pockets or private pay, may be affected. Think about insurance companies, maybe physicians, maybe managers. That's going to have to increase their staffing. And they're usually already on tight budgets. So just kind of look at the big picture about that bill. Usually there's always someone that this is going to affect, either in a negative and in a positive way. And then lastly, once your conclusion, that should be your last paragraph of your paper, first level heading of conclusion. And describe how you can change or influence policy decision and advocate for this change. So if you're supporting this bill, what can you do to help bring attention to this bill? How could you advocate for change? Would that maybe joining, if you're doing safe staffing, maybe joining the ANA, maybe bringing this to the attention of your other workers, co-workers, to get involved with policy. Maybe it's another organization or committee. Maybe it's somewhere in your hospital, could be at your state level. And then I want you to include a specific legislator you would communicate with. Ideally, that should be whoever is representing you in Congress. So if you're looking at a bill at the federal level that you want to be passed, who is your state House of Representative? Who represents you in the House? Who maybe represents you on that level? So look about that bill, look about where that's at in the process. And again, it may not be your House of Representative. Maybe it's that committee chairman. Maybe this bill is at the committee chairman level and how great influence they have. Maybe you want to write to that committee chairman and say, hey, this bill needs to be looked at. This bill needs to go through the process and go to the next step. So just think about that specific legislator you want to communicate with, because you will, whoever you select in this paragraph, this is what you're going to take that person and write your letter, your next assignment that's due towards the end of the semester. So just kind of look at that. And that should be one paragraph. It could be two if there's a lot of information you want to share, but at least one paragraph. And total points for the course is 100 points. Your reference page should be the last part, and I should see at least at the minimum 3 scholarly articles for those sections of the paper. Your health policy presentation is just going to be taking your paper and compiling that into a presentation form. It will be a PowerPoint presentation, at least 5 to 7 minutes. And I do not want you to be copying and pasting your paper directly onto your PowerPoints. I just want bullet points on each of the PowerPoints that I have pretty well laid out here for you. I think it's pretty thorough. Make sure you have a title page and then a reference page at the end of your slide. I want to have your voiceover, so I just want bullet points on your PowerPoint, but then I want you explaining your what your findings for your paper on each of the slides. So really want to hear you to disseminate that knowledge and not just read all of your slides. So make sure your PowerPoint slides are just bullet points. Make sure you include your scholarly articles in your PowerPoint slides. You want to make sure you cite your sources, and then you'll reference them on that last reference page. So I think everything else is pretty self-explanatory. Your PowerPoint presentation will be again 100 points following the rubric. After everyone has posted their PowerPoints or whenever, you can respond to at least 3 other students' peers' presentations. Make sure a meaningful response, so not just great, I agree with you, I support the bill as well. Maybe provide what you learned in their presentation. Maybe you did not know about the Concussion Act or the Fresh Air Act. So disseminate to them what you've learned through their finding. I really would like you to look at someone's PowerPoint presentation that did a bill different from what you did. I know a lot of people are doing a similar one, so that may not be completely possible, but I encourage you, try to look at something different, trying to give you a different perspective of what healthcare policy issues that are out there. And again, if you have any questions, please let me know.